Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. How to get something out of your ear. The best way to get something out of your ear, whether it's deep or at the edge, will depend on what it is. While there are some home remedies you can try to remove an object or clear a blockage, you don't want to make the problem worse. You may need to see a healthcare provider to resolve the issue. /r/n/r/n Objects that could get stuck and cause ear pain, especially among children, include small toys and beads, but also pebbles, insects, or food. In addition to ear pain, it may cause drainage or even muffled hearing loss. People also may feel like something is stuck in an ear when it's really an infection or earwax. /r/n/r/n This article explains both the techniques you can try to remove an object in your ear, as well as what not to do. It will help you to know when you need to see a healthcare provider to clear your ear. /r/n/r/n Illustration by Michela Buttignol for Verywell Health /r/n/r/n It's common for people with something stuck in their ear to see a healthcare provider. One study of 333 children, with a mean age of about 6.5 years, found about half were seen in an emergency department for objects that couldn't be removed. These common objects include /r/n/r/n The most common item found in the ear is cotton. Other items in ears can include paper, and pebbles and rocks. Water beads can be a special problem in the ear because the toy beads are designed to swell in size. /r/n/r/n If you notice something in your ear, stay calm and try at home to remove it. However, if it is lodged or doesn't come out right away, be sure to seek medical attention. It's also important to get immediate care if your symptoms include difficulty breathing or trouble with staying alert. Keep in mind that certain objects, like sharp items, an earring, for example, present a greater risk for injury. /r/n/r/n People will often feel the pressure and discomfort of an object lodged in the ear. They also may be aware of what happened when it became stuck, although nonverbal children may not be able to explain it. In some cases, as with an insect in the ear, you may not know that it's happened. /r/n/r/n Among the more common symptoms that you have with an object in the ear are /r/n/r/n Some people also may experience dizziness or balance problems, depending on what exactly feels stuck in the ear and how long it's been going on. With a stuck earwax plug, there may also be a cough or itchiness around the ear. /r/n/r/n Foreign objects often can be seen in the ear. If you can't see it, a healthcare provider may be able to visualize the object using a special scope, called an otoscope, to look in the ear. /r/n/r/n There are a few techniques you can try when a foreign object is stuck just inside the ear. /r/n/r/n Sometimes using gravity can do the trick to encourage a foreign object in the ear to move outward. This technique is helpful if you can see the object. /r/n/r/n To use gravity to encourage an object out of your ear, tilt your head to the side. You can gently shake your head to try to move it downward, but avoid banging on your head. Importantly, this technique uses only gravity and no other assistance, so don't stick anything into your ear to reach the object. /r/n/r/n Never stick anything into your ear to try to get an object out. Doing so could make matters worse by pushing the item deeper, lodging it in a more difficult place, or injuring your sensitive ear canal. /r/n/r/n If the object in your ear is an insect, you should turn your head so the affected ear is facing upward. Sometimes the bug will crawl out. If the critter doesn't emerge, you can try warm oil to see if that helps the insect float out. /r/n/r/n To use oil in the ear, follow these steps. /r/n/r/n If it does not come out, you should seek medical care. However, even if the bug comes out, it is still essential to see your healthcare provider since insects and their parts can irritate the sensitive tissue of the ear canal. /r/n/r/n never stick fingers or other objects into the ear when trying to remove a bug. Doing so may cause the insect to bite or sting. /r/n/r/n over-the-counter OTC earwax removal products that contain hydrogen peroxide are an alternative to warm oil. They will produce gas bubbles, which may help dislodge the object so it can fall out. /r/n/r/n There are limits to what you can do about getting something deep out of your ear. In some cases, a healthcare provider will need to remove the object, or you may need to make an emergency department visit. /r/n/r/n Keep in mind that the anatomy of the ear includes the middle and inner ear, and it's less likely that a foreign object is the reason when these areas are affected. For example, a ruptured eardrum can cause pain, hearing loss, and ear drainage, too, but the injury is often caused by sound or pressure changes, not an object. /r/n/r/n Objects deep in the ear also may be stuck for a longer time as you've tried unsuccessfully to remove them. How long an object can safely remain in the ear depends on the type of object, but generally it is more likely to cause injury, infection, or increased pain if it is there for a longer time. /r/n/r/n Hearing aids don't usually get stuck in the ear. But parts may become more vulnerable with use and care, like cleaning, if you take them apart. Contact a hearing specialist if you think a hearing aid or one of its components is stuck in your ear. /r/n/r/n In your attempts to get a foreign object out of your ear, you should not insert anything into the ear. You also should try to prevent a child from doing so. Examples include /r/n/r/n You also don't want to try flushing the object out with water. This therapy, called irrigation, should be done by a healthcare provider. /r/n/r/n While warm oil is a home remedy that may work for removing an insect that's not deeply lodged, it should not be used for other objects in the ear. Much like the problem with water beads, the oil could make an object like food or paper swell in size and become more stuck. /r/n/r/n Keep in mind that the ear candling alternative, placing a lighted candle in the ear to create a vacuum, is not a recommended technique. Some people do this when they think an ear is blocked by an earwax plug, but ear candling isn't effective and you can cause a serious injury. /r/n/r/n If the object in your ear does not fall out on its own, you should seek medical attention. The sooner you seek help, the better, since an object left too long in the ear can lead to infection and damage to tissues in the ear, including the delicate eardrum. /r/n/r/n This is a common complaint in the emergency department in children and adults. Emergency room healthcare providers perform a thorough exam using tools to look into the deeper part of the ear and magnify the area so they know what object they are removing. /r/n/r/n Treatment will depend on first identifying the object. Home attempts without visualization can worsen the problem by pushing the foreign body deeper, expanding the size of the object, not fully removing the object, or puncturing/injuring the ear. /r/n/r/n Doctors use several methods to extract foreign objects in the ear. These may include /r/n/r/n Only qualified healthcare providers should perform these interventions. You should never attempt them at home. Your provider also can discuss self-care with you, such as using warm compresses for pain relief or chewing gum to relieve ear pressure. /r/n/r/n In some cases, the symptoms of pain, pressure, or hearing changes associated with a foreign object in the ear actually have a different cause, like infection or eustachian tube dysfunction. It's important to see a healthcare provider for an accurate diagnosis. /r/n/r/n Foreign objects, including bugs, pebbles, and food, commonly end up in people's, especially children's, ears. You can try a couple of things at home, like using gravity to let an object fall out or oil to help an insect float out. /r/n/r/n However, it's vital never to stick anything in your ear during your attempts, as that can cause an object to lodge even deeper. It's likely that a healthcare provider will need to remove an object that's too deep for you to see or reach, and it's important to know if you actually have another reason for your symptoms. They can diagnose the cause. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.